Hi, I'm Vincent, and I'm an undergraduate student at St. John's University. I'm a member of the Collaborative Health Integration Research Program, CHIRP, housed at St. John's University. Recently, my colleagues and I conducted research on racial discrimination and types of food consumption across two studies. In this research, we examined recent and lifetime discrimination and types of food consumption in two samples, an American Indian Alaskan Native sample from Colorado and a diverse sample from New York City. We found that recent discrimination is significantly associated with overall food consumption and unhealthy food consumption across both samples. Previous literature suggests that racial discrimination is linked to health disparities and poor health outcomes. Health behaviors may partly account for this relationship. However, there is limited research on the relation of discrimination to food consumption. In our research, we utilized a combined sample of 435 adults. Study 1 included 142 ethnically and racially diverse participants who were recruited from a New York City community medical center. Study 2 included 294 participants who all identified as Native Americans. Individuals were recruited from community events or by word of mouth in Colorado. Lifetime and past food discrimination were assessed using the brief Perceived Ethnic Discrimination Questionnaire community version. Food consumption was assessed through a self-report survey, which assessed the number of days participants ate various food items in the past 7 days. Multiple regression analyses were performed on the combined sample to investigate whether there were discrimination effects on consumption across the two samples, and if there were any differences between the samples in relations of discrimination to consumption. We examined overall unhealthy and healthy consumption. Analyses were adjusted for age, gender, marital status, race, and education. We found that lifetime discrimination was significantly positively associated with overall consumption and unhealthy consumption, but not healthy consumption. In each analysis, the interactions of lifetime discrimination by sample were not significant, indicating that effects of discrimination on overall and unhealthy consumption were consistent across these very different samples. Past food discrimination was significantly positively associated with overall unhealthy and healthy consumption. Again, the interactions of sample by past food discrimination were not significant, suggesting the effects of past food discrimination on consumption are consistent across the samples. Overall, the data suggests timing matters. Recent discrimination may increase consumption of all types of food. These effects could be a function of acute effects of discrimination on negative mood, inhibitory control, or other factors that affect eating behavior acutely. Lifetime discrimination appears to specifically affect unhealthy consumption. Lifetime discrimination may produce changes over the long term in eating habits. Future research should examine mediators of discrimination, timing, and consumption types. Limitations include a convenience sample and discrimination was self-reported. In conclusion, the data suggests that discrimination has effects on eating behavior across very different samples, and add to the literature suggests that discrimination drives consumption as has been seen in studies of smoking and binge drinking. Thank you for your time. For more information on our study, scan the QR codes on the screen.